So, welcome back to my channel. Today I would start the topic of the deltoid region and inferior clavicular region. Now we move on to the topography of the deltoid region. In this topic, first we would see what are the landmarks and what are the locations near to this deltoid region. Now, superiorly, there are three parts: lower border of the spine of scapula, of scapula, then lateral border of acromion, and third one is the lateral 1/3 of the clavicle. You can see here in this triangle, first part is the lower border of the spine of the scapula, second is the lateral border of the acromion, and the third is the lateral 1/3 of the clavicle. Now inferiorly, this is deltoid tuberosity of the humerus, anterior border and posterior border of the deltoid muscle. Now this landmark of this region: anterior and posterior border of the deltoid muscle, clavicle, acromioclavicular joint, acromion, and spine of the scapula. These are the landmarks. Now we move on to the borders. What are the borders of this deltoid region? Superiorly, if we draw a line on the deltoid muscle, the lateral 1/3 of clavicle, acromion, and lateral 1/3 of spine of scapula. This would be the superior border. Now inferior border, there would be, if we draw a horizontal line on the lower margin of the pectoralis major muscle and latissimus dorsi muscle, horizontal line drawn on the lower margin of pectoralis major muscle and latissimus dorsi muscle. Now in the anterior region, anterior and posterior region, just remember anterior margin of the deltoid muscle and posterior margin of the deltoid muscle. Anterior margin and posterior margin of deltoid muscle. Okay. Now we move on to the layers of this deltoid region. Now first layer is the skin. The skin, it is thick with limited movement. Okay. Now in this region there is a one muscle, deltoid muscle. In this deltoid muscle, near the skin, deltoid muscle, the upper half of the deltoid muscle, upper half of the deltoid muscle, it is supplied by lateral supraclavicular nerve. Which nerve? Lateral supraclavicular nerve. And the lower half of the muscle, it is supplied by superior lateral branch of cutaneous nerve. Superior lateral branch of cutaneous nerve. Okay. Now in the skin is thick with limited movement, and in deltoid muscle it is divided into two parts, upper half and lower half. Upper half of the muscle is supplied by lateral supraclavicular nerve, and lower half it is supplied by superior lateral branch of cutaneous nerve. Now we move on to the next layer, subcutaneous tissue. Now in this subcutaneous tissue, there is moderate amount of fat and it is divided by septa. There is moderate amount of fat and it is divided by septa. Now before going to this, there are two divisions of this subcutaneous tissue. One is superficial fascia and deep fascia. In superficial fascia, there is moderate amount of fat and it is divided by septa. And in deep fascia is again divided into two layers, superficial layer and deep layer. Now here, moderate fat and divide by septa. And in deep fascia in superficial layer, now it covers outer surface of deltoid muscle. Okay, deltoid muscle, and it contains with the pectoral fascia. It continues with pectoral fascia. We will study this fascia in the further topic. Okay, and this pectoral fascia, it divides this muscle into three parts: clavicular, acromial and spinal. Clavicular, acromial and spine, means spine of scapula. Okay, not vertebral spine. Fine. Now this deep layer, there is a this deep layer, there is a deltoid nerve, and this deep layer, it continues with the fascia covering the tricep brachii muscle behind. Okay, this layer continues with the fascia covering tricep brachii muscle, and this it sends numerous septa and fascicles. Okay, now last topic, we would come to the muscles. Now in deltoid muscle, there is unipennate and multipennate. Unipennate is clavicular and scapular. Unipennate is clavicular and scapular. Okay, clavicular is anteriorly, unipennate, it is clavicular, which is anteriorly, and scapular, which is posteriorly. And multipennate is acromion, which is in middle, multipennate is acromion, which is in the middle. Okay, now this unipennate and multipennate fibers, it all comes and innerts, their insertion is to the deltoid tuberosity in the humerus bone. Okay, now this was about the deltoid muscle, but what is action of this muscle? Action: abduction. Now abduction, what does it mean? It takes away from the body. It takes away from the body. It pulls the arm forward and pronating a bit, slightly. Okay, and also pulling the arm backward and supinating slightly. Now, this clavicle muscle, the anterior part means clavicular part. This anterior part helps the pectoralis major muscle in flexion and medial rotation of the arm. And posterior part helps latissimus dorsi muscle in extension of arm and lateral rotation of the arm. Now, till now, we have studied the deltoid region in detail. Now, just keep in the mind what all the things are coming into this. Okay, spine of scapula, acromion process, clavicle, deltoid muscle in obvious, deltoid tuberosity of the humerus, and main nerve, lateral supraclavicular nerve, which is upper half, which supplies upper half of the deltoid muscle, and superior lateral branch of the cutaneous nerve, which supplies lower half of the deltoid muscle. Now, subcutaneous tissue. After the skin, in the subcutaneous tissue, there are two fascia, superficial fascia and deep fascia. In deep fascia, there are two layers, superficial layer and deep layer. In superficial layer, it covers the outer surface of the deltoid muscle, but it continues with the pectoral fascia and it is subdivided into clavicular, acromial and spine. This fascia subdivides the muscle into clavicular, acromial and spine, which is scapula. The deep layer of this deep fascia, there is a deltoid nerve, and this deep layer continues with the deep fascia covering tricep brachii muscle. Now, this muscle, deltoid muscle, there are two types, unipennate, multipennate. In unipennate, the clavicular and scapular part would be there. Clavicular is anterior, scapular is posterior, and multipennate is the acromion, which is in the middle. All the fibers, it comes and joins to deltoid tuberosity into the humerus bone. Okay. Now this was about the deltoid muscle. What is the action? Action is the abduction. What does it mean? It takes arm forward and pronates slightly, and also taking arm backward and supinating slightly. Now, the anterior part of this muscle helps the pectoralis major muscle in flexion and medial rotation of the arm, and posterior part of this muscle helps latissimus dorsi muscle in extension and lateral rotation of the arm. So till here, I hope it is clear. Now we move on to the next topic, which is topography of the subclavian region. Okay. Now this is also called as infraclavicular region. Now landmarks. The main landmarks of the subclavian region are sternum, clavicle in obvious, coracoid process. Okay. Third rib, cephalic vein, pectoralis major muscle, deltoid muscle, and border between these two muscles. These two muscles. Okay. Which is also called as sulcus, deltoid, deltoido pectoralis. Okay. Now we move on to the border of this subclavian region. Superior border, there is clavicle. Okay. Inferiorly, if we draw a horizontal line through third rib, which is in men, and in women, upper margin of the mammary gland. Upper margin of mammary gland in women. This is the inferior border of this region. Now medially, there is lateral margin of the sternum and laterally there is anterior margin of the deltoid muscle. Margin of deltoid muscle. Okay. Now we move on to the layers. The layer of the subclavian region, it is very thin skin and movable. It contains sebaceous gland, and it is innervated by supraclavicular nerve, which is a branch of cervical plexus. Okay. Now next is the subcutaneous tissue. Subcutaneous tissue is well developed, especially in women. Well developed especially in women. It contains cutaneous nerve and it contains veins. Which one? One is thoracoacromial and thoracoepigastric, which further this vein forms cephalic and axillary vein. Okay, this further vein, it continues cephalic and axillary vein. Now superficial fascia. Superficial fascia, it is thin, firm. Now this superficial fascia, it is attached to inferior margin of the clavicle and upper margin of the mammary gland. The superficial fascia, pay attention to the superficial fascia. When the topic would come clavipectoral fascia further, I would explain this. Why? Because the superficial fascia attaches margin of the clavicle and upper margin of mammary gland. Which further it forms ligament, which is called Cooper's suspensory ligament of mammary gland. Okay. Now next is the deep fascia. Deep fascia is also called as pectoral fascia. Pectoral fascia. Okay. Now this deep fascia, it covers the pectoralis major muscle. And this pectoralis major muscle is divided into three parts. Which is clavicular, sternocostal, and abdominal. Now, border of this deep fascia. Borders of this deep fascia are: superiorly there is clavicle, inferiorly fascia of serratus anterior muscle and rectus abdominis muscle. Medially there is a sternum, and laterally deltoid and axillary fascia. Now next is the proper fascia. Now this proper fascia is called as clavipectoral fascia. Clavipectoral fascia. Now this clavipectoral fascia, I am drawing a diagram, small short diagram, through which you would understand how does it form. See, this suppose is the pectoralis major muscle. Okay, here is the clavicle bone. Okay, it is subclavius, and from here it extends down into pectoralis minor muscle. It covers this pectoralis minor muscle and it goes down as the suspensory ligament of the axilla. See, I will tell you. This is pectoralis major muscle. This is clavicle. Here is the subclavius. This is pectoralis minor muscle. This is the subclavius, clavipectoral fascia. Okay, and this is the suspensory ligament of axilla. Okay, do you understand this? Here is the pectoralis major muscle. From the clavicle, this proper fascia, it extends, it covers the pectoralis minor muscle, and further it extends the suspensory ligament of axilla. Now, between this subclavius and pectoralis minor, here it is called as clavipectoral fascia. Okay, till here we have done our topic of subclavian region. Few more extra points about this clavipectoral fascia. Now, the structures which would pierce through this fascia are cephalic vein, which drains into axillary artery, axillary vein. Cephalic vein drains into axillary vein. Now next, which pierces through this clavipectoral fascia is thoracoacromial artery. Which is a branch of the second part of the axillary artery. This is branch of second part of axillary artery. The third is lateral pectoral nerve, which is lateral cord of brachial plexus. Lateral cord of brachial plexus. And also some lymphatics also pierce this fascia. Now, one more thing. The suspensory ligament of axilla, which is also called as Gerdy's ligament, also called as Gerdy's ligament. Okay. So I hope you understood both the topics. Please revise it, understand it. And next topic I would start from the arm, upper arm. Thank you for watching the video. Please like, subscribe and share the video. Thank you.